Hello, I'm Danielle Hawn, Program Coordinator for Lake Region Special Education.
And I'm Barry Sundeen, the former Director of Harmony House.
We are very excited to announce the development of the Devils Lake Day Treatment Program. This is an exciting new program that's been developed to target the needs of youth in the Lake Region who have difficulties with academic success, mental health needs, and lack access to consistent services. This is not a special education program, but rather a program that will be utilized to target the needs of students throughout the Lake Region Special Education Unit. With collaboration between Devils Lake Public Schools, administrative staff, and the Lake Region Special Education staff, we have created this program located at Central Middle School in Devils Lake to meet the needs of students ages 11 to 15 who are struggling with behavioral or emotional difficulties. This program is not limited to students in special education. Students who would be appropriate for our program would include those that have trouble accessing services for mental health or physical health needs and have received multiple behavioral interventions with limited or no success. Also, students who are at risk of an out-of-district placement away from their home or who are returning from a current placement. Our program will provide transportation for students to and from the day treatment program, if it is appropriate, or we will work to find a way to assist students within your building. We will include inclusion in the general education setting along with support in a separate location. We will focus heavily on mental health needs through the provision of counseling, social emotional learning, sensory tools, restorative justice practices, and art therapy. Students who attend the Devils Lake Day Treatment Program will remain in their homes with their families. They will receive support during their school day. Staff will help to transition the student back into their homeschool setting and apply strategies that they have learned. The referring general education teacher will continue to remain a part of the programming throughout placement.
We have utilized guidance from the North Dakota Day Treatment Program Guide created by the Division of Juvenile Services to develop a program that can meet the needs of regular and special ed students. This program is developed to address the needs of at-risk youth prior to placement away from their home and community with supports in place to address educational and therapeutic gaps. Admission criteria. Male and female youth that are between the ages of 11 and 15. Students who are at risk of out-of-home placement within the juvenile justice or child welfare system. Youth demonstrate academic, emotional, legal, or behavioral problems in more than one area of their lives. Previous interventions that have been tried and were not successful in the home and the community. Documentation of these attempts, interventions, and outcomes must be included in your referral. The child's family and or guardian are willing to participate in the program and function as a team member in the team process. The core day treatment team is comprised of myself, a master's level social worker, Sue Lovegren, who is a qualified ED and LD accredited instructor and experienced behavioral interventionalist. Sue is a qualified art therapist as well. I will use behavioral and group strategies to enhance classroom behavior and pro-social skills. Both Sue and I will work with the students on social emotional curriculum, utilizing restorative justice practice and overseeing academic tasks. More students may meet criteria for placement than what we have spots for. So placement is on a first come, first served basis. Students who are eligible for our program will be determined by the team, including day treatment staff as well as staff from their home district. The admissions team, along with referring district representative and parent, will develop a treatment plan based on the intake information. This treatment plan will be adjusted as the team feels students have reached their goals.
For exit criteria, a student is going to be considered ready to be completed with our program if they are able to be in the general classroom setting with learning ready behavior for the entire day with minimal supports. The student may need to take breaks as appropriate. Work completion is expected at a passing level with consistency. The implementation of learned behavioral strategies in the general ed setting is expected. If students are able to demonstrate these behaviors, then they are ready to return to the school setting. As students are gaining skills, their team is going to continue to meet to work to increase the time the student is in the school setting with support, and eventually work on a plan to transition back entirely into their home school district. Though there is not a set amount of time that the student will be in our day treatment program, it is generally expected that goal attainment is going to take between 3 to 6 months, during which time the relationship with the home school district continues to be nurtured. A student may be dismissed from the program if their behavior is harmful to our staff or to other students, or if they are in danger to themselves or others. Also, if the treatment team feels that the program is not a good fit for the student, or if the family decides to explore other options. But we will work together to ensure that this is not an abrupt change, and it is something that we work together to create a transition plan for. For intake and evaluation, the referral needs to be made through the school's MTSS team, which should include the parent. At the point that a referral for our program is being considered, it is helpful to bring in your school's Lake Region Special Education Program Coordinator to the discussion so that they can help to review these program expectations and answer related questions. Our team, including Barry, myself, or Sue, could also be included in these meetings if you are starting to discuss day treatment. Behavior interventions must be documented, and data must be used to support the need for these additional services through our program. A referral could also be made as a step down from an outside treatment facility, such as if a student was returning from a placement at the Boys Ranch. A current social emotional assessment is going to be required for intake. If one hasn't been completed, we will get that scheduled upon intake. This will help us to drive the students' treatment goals. The admission team is going to be comprised of the school building principal, the school special education personnel, even if that student is not in special ed, because these staff are often serving as the school's behavioral experts. The classroom teacher, any involved agency or referral agent, the day treatment team members, and other involved professionals, as well as the parent and guardian, will be involved in this admissions team.
Devils Lake Day Treatment works in conjunction with LifeWise Associates, an agency that provides counseling, therapy, group activities, drug treatment, sensory, and medical services. Most students attending our program will be referred for mental health related services with this agency. However, if a provider is not available in this agency to meet the needs of the student will be referred to another local agency in Devils Lake. If an established relationship already exists with another counselor in the community, the team will consider this, and the team will work with the parent and the present provider. If special education testing has not been completed previously, the team will consider pursuing this option if it is appropriate. If there is an educational need, review of the student's current district-wide assessments will be helpful to determine if this is necessary and at what level the student is currently working. In this event, the procedure for special education assessment will be followed. The day treatment team will meet with the referring school team and parents to determine what targeted areas will be addressed through treatment. Staff will also complete a review of any medical appointments that includes health, immunizations, dental, vision, and assist in addressing any areas of concern and needs. Sensory evaluation may be recommended. The admissions team will gather a list of all agencies involved with the team, with the family and student, to review any interventions and services tried in the past. Upon completion of or in conjunction with these assessments, the day treatment team, along with the admissions team, will recommend admission, referral, or other prescribed treatments upon options for the student. Devils Lake Public Schools uses a second step program for education for social emotional needs. In addition, restorative justice practice such as circle talks, restorative conferencing are utilized with students. LifeWise may have an additional social emotional program that they feel would be appropriate to meet the needs of specific students that will also utilize through their treatment. Social emotional curriculum will be utilized to help meet the students' needs by teaching them how to handle given situations that may be frustrating, intimidating, or overwhelming, and giving them tools to use to respond to these types of situations appropriately. Addressing these concerns will help students who are at risk to develop skills to handle various situations and lead to reduction of their risk for additional concerns.
Academic concerns are going to be reviewed constantly and assessed as appropriate by the team. As part of our lagging skills assessment, which we will complete upon intake, academic needs are going to be addressed as appropriate for the student. Part of what makes the day treatment program successful for students is it allows them the opportunity to complete work in a separate, safe, small environment with a lot of support. The assigned special education teacher for our program, Sue Lovegren, will oversee all of the academic work. General education teachers are going to continue to be involved with the student's programming so as to keep that connection for the student to transition back to his or her home classes. And ultimately, the general ed teacher will continue to assign grades for the student regarding credit. Whenever possible, students are going to continue to use their core classroom curriculum, utilizing technology such as Teams or Google Classroom or even paper pencil methods. If an alternative curriculum needs to be utilized, the team will determine what is most appropriate, but would likely utilize a program such as Odyssey-ware to meet the student's needs. The team will work to continue to have the student incorporated in at least one class in the school setting whenever possible, and continue to build upon that, adding more classes as the student becomes more and more comfortable. Planning for re-entry to classes needs to happen from the initial placement meeting and reviewed consistently. It is the responsibility of the regular education teacher to attend meetings, provide materials, and assist with the transition back to the regular ed setting upon completion of the student's goals.
Integration and transition planning. Careful cooperation planning and staging are necessary to promote the reintegration to regular classes for the youth served. A guiding principle is to return the student to their grade and peers as soon as academic and behavioral remediations is at a stage to support the transition. Often students are reluctant to leave the day treatment setting where they are experiencing successes. Regular education must be willing to show positive acceptance to the returning student. It is the intention of this program to begin by sending students into the regular classroom setting with a para support who had worked with them in the program and are able to give them cues when needed to use their skills that they have learned. Students' team will help to determine how long that support is needed. Restorative justice practices will be utilized with a student, which may include writing something or someone who has been wronged. This may include student volunteer programs or restitution, along with meeting with specific individuals involved. The day treatment team will work together to improve and strengthen family connections with the school. Family involvement in placement is necessary to improve the student's success. This involvement will include home visits from the staff, phone calls, working with therapists and referrals for additional supports and services. Parent classes can be assessed as needed.
The specific outcomes of the day treatment program include increasing grade and achievement levels in underachieving youth, preventing out-of-home or more restrictive placements for youth in child welfare, juvenile justice, or special education systems, to reduce the number and severity of the youth's juvenile court citations, to reduce truancy and dropouts, to improve specific classroom behavior problems, and to improve the graduation rates of students with significant emotional and behavioral needs. The above outcomes are measured by pre- and post-test data collection, which will happen through our program. Other less measurable but still expectations for this program are improved climate in the regular classroom due to a reduction in disruptions, increased interagency planning and greater service provision in this given area, parental and child improved relationship and skills in living, community ownership of the problems of youth and families, and the development of a sense of belonging and self-worth for troubled youth.
Student progress will be measured utilizing team input regarding the student's goals and through increased engagement in the general ed setting, which will lead to the student being fully integrated back into the general education setting.
If you have a student in mind who you think might benefit from our program, please reach out to your administrator and MTSS team to start this discussion. An application for our program is included along with this video, but can also be accessed on the Lake Region Special Education website, and that can be accessed by any staff member in your building who works with special education. Remember though, this is not a special education program. This is an intervention program for regular education students or for special education students whose needs cannot be met in the general ed programming with special education supports. We look forward to working with teams in your buildings and hearing from you soon. If you have any questions, you can contact myself or Barry at Central Middle School, 701-662-7664.